All right, Neville, thank you. Now, as we get closer to the summer months, our warmer temperatures will be here to stay, and that means you need to protect yourself from the sun.
Dr. Rajpara with University Health is joining us now to share some good advice. He is a dermatologist. So first, everyone's at risk of developing skin cancer, but are some more at risk?
Yes, so we see several risk factors for skin cancer. One of those is a history of blistering sunburns or peeling sunburns and a history of tanning bed use. And yes, we still do see people using tanning beds. If you grew up in the 60s or 70s and you like to use baby oil and iodine like a lot of my patients, you're definitely at risk of skin cancer. Having a family history of skin cancer, in particular a sibling or a parent with melanoma, will increase your risk for skin cancer. Having a lot of moles, specifically more than 50, puts you at increased risk. And then even certain medications, like a very common blood pressure medication, hydrochlorothiazide, can put you at increased risk for skin cancer as well.
So a lot of things to consider. So is sunscreen the best prevention then?
Yeah, so sunscreen is one of our best tools. We recommend an SPF 30 or more broad spectrum sunscreen. You want to apply every 2 hours or after swimming. Sun avoidance obviously is another tool. You want to avoid the peak UV radiation hours, which is between 10 and 4. And then for a lot of my patients, they don't want to be putting on sunscreen every 2 hours and remembering to put it on, putting it on your kids while they're at the beach. It can be very difficult. So now sun protective clothing is very popular. So wearing long sleeve t-shirts with SPF in it and broad brimmed hats is a great choice.
We're seeing more of that out there.
Yep.
We are. It's more available to adults and children. What should people look for on their skin that might make them concerned and they should see a professional?
So the thing we worry about the most is melanoma skin cancer. That's the deadliest skin cancer. So we always educate patients about the A, B, C, D, E's of moles and what to look for. So A is asymmetry. So if you cut your mole in half, if one side doesn't look like the other side, that's concerning. B is for borders. So mole should be kind of a nice round shape. If it has irregular borders, blurry borders, notch borders, that's worrisome. C is for color. So if it has multiple colors, black, brown, even blue, white, red in there, that's concerning. D is for diameter. So if it's larger than the head of a pencil eraser, that can also be concerning. And then E is probably the most important. It means evolving or changing. So if you notice a mole changing size, shape, color, texture, that's a very worrisome sign. So if you notice any of those things, obviously go see your dermatologist.
All right, good advice. Thank you, doctor.
Yeah, you're welcome.
Thank you very much.